So our study was looking at attitudes towards colon screening and how they were impacted during the pandemic, both related to concerns about the pandemic and safety, as well as to economic impacts of the pandemic. And what we learned is that fecal occult blood testing was seen by patients as a viable alternative to conventional screening, or what's generally accepted in the United States as the gold standard for screening, which is colonoscopy. And I think really the key message of our work is that in the pandemic, us as healthcare providers have to be willing to pivot away from what we've previously accepted as the standard or best practice for processes and come up with alternatives to provide the best care for patients.
The key message from our findings is that barriers to screening has increased during the pandemic, and we have to find ways to work with the community in order to increase those rates. And so our study found that people are doing stool-based at-home testing and that they're compliant and willing to do that.
The other point I'd like to make is that even pre-pandemic, the screening in the United States were very far from 100%. So I think the lessons that we're learning from the pandemic and working with patients to find alternatives to what the conventional approaches have been in the past, these are going to be applicable to care moving forward, even if we do ultimately enter a post-pandemic state, which is what, of course, we're all hoping for.